So the things that we could do as a physical therapist in the military, so there was a small formulary that we could order off of. The medicines were normally anti-inflammatories. There were muscle relaxants that we could order. Also, we could order dose packs, which sometimes were actually very helpful, with folks that maybe had a hot nerve or something. Also, we could order all the imaging studies. So CT scan, so we could do MRI, imaging studies, like x-rays and so forth, we could do that. Also, so lab stuff, we could order, so SED rates and look at, different markers for, inflammation and so forth. And so it actually really, allowed us to use the education that we have and also work these patients up quickly. And if there was a patient that we were seeing that we felt like this patient actually needed to see their physician, and we would just actually put that referral in and they would go see the physician. Or if it was a back patient or something and there were red flags that we actually found, then we would just refer the patient off to the emergency room and they would go, seek care there. So it was a very fluid way to see these patients and also actually very efficient. Because I think on the other hand, in the private sector, oftentimes the route to get in to see like a physical therapist is they'll go see their primary care provider. So that could be like a PA, it could be a nurse practitioner, it could be a physician. So they would do the screening and order tests and then if they actually thought it was appropriate, they would put a referral in for physical therapy. And then that oftentimes can take a week to maybe 10 days to get in to see the therapist. It can be even longer depending on your location and so forth. And so, it's just, so we know that, from the studies out there that they support, the sooner we can see these patients. So normally the quicker we can get the patient back to work or so back to their life and the things that they would like to do. So I think it's a much more efficient use of physical therapy. I think we have the skill set, and I think there's a lot of pluses to doing things that way. There are some states that they're coming along to kind of actually catch up with that. I think there's several states now that they've okayed PTs can order x-rays and clear folks and so forth. Just initially, the information out of those states is that the PTs that have those privileges are really using those skill set very, very so judiciously. Yeah.